Hi. I'm really sorry that we've had this short delay, but we are learning as we're going. This is my very first experience on live Facebook, so I'm learning something new today. And most days I learn something new. So welcome to this session. I will do my very best to answer the questions that have already come through. I may not be able to answer all of them. And the other thing that to really understand is that for some of them, I require a detailed history to be able to give you the individual information that's required for you and your baby. So please consider that if I haven't given you enough information, that you might like to contact one of my team and have a Skype session with me, because it's very important that I don't misinform you about what's really important about you as an individual mother and baby. I will answer as broadly as I can the responses to the questions today, so that you can get a picture that will help you understand maybe what you can do to make things better for yourself. As you know, most of the women that I see have problems or complications, so my work is based on my research, where all of the women in that research were seen with complications. Today I will do the best I can to stay for as long as I can to get through the questions, and if we don't, then that means that we'll try and catch up in the next session, and I will be doing some more sessions to follow this. So we will give you the dates on the site, and so feel free to join us again if you need to. So let's do the best we can together. The other thing I say from the beginning is that pregnancy, labour, birth and breastfeeding are natural transitions, that they're not really meant to be disconnected from each other. A mother grows her baby, she gives birth to her baby, and if she chooses, she breastfeeds her baby. The other thing that's really important is that almost always a mother is right. She uses her instinct constantly. She's aware of what's going on with her baby, and so it's really important for people like me, the professionals, to listen to what she says, to understand what she says. And at any time, as a mother, you don't feel well, or you think your baby is unwell, it's really wise to seek support from the people that you know best and to visit your professionals. Very, very important not to let things go too long. Okay, so today's first question, occasionally I'll be looking at the question, so please excuse me if I'm not looking directly at you. There's a question from Twinkling that says she's very confused about her baby's breastfeeding schedule. So in this information, I don't have enough to say how old the baby is, but if we start from and talk about the newborn and the young baby, these little babies don't actually have a schedule. They feed to their hunger and their calorie needs and their fluid needs. They actually know when they need to have fluids and when they're hungry and when they're thirsty. So most young babies, and particularly newborns, feed somewhere between 7, maybe 8, and as they get a bit older, they'll drop off to 6 and so on in 24 hours. But they need in that time to have both breasts per feed, which means in my practice, if you've been looking at some of my video clips, is that they feed from one breast till they reach satisfaction. That's till their stomach has reached capacity and they know that they've had enough and they start to drift. They stay at the breast and they just nurture for a little while before they actually slip off the breast. So then they've reached gastric capacity and they've reached emotional satisfaction. And then it's time to lay back and have a little rest, stretch out, especially the middle of the body, stretch out, and you'll see hands go above head as they stretch. And what happens there is the enzymes are breaking the milk down and curdling it before it goes into the intestine. And so that pre-digestion in the stomach helps the baby's intestine then carry on the next level of digestion. When the baby's ready to have the milk from the second breast, and however much that is, we don't know, only the baby knows that. The baby will refill the stomach to its own satisfaction. It will feed and then it will drift off again and then it will slip off. And then it's time to hold the baby up and snuggle in and let that body stretch out again and let the baby finish that pre-digestion from the second breast and then off to sleep. And then, you know, from start of feed to start of feed, roughly 3.5, occasionally 4 hours. But somehow they fit 7 feeds on the average in 24 hours. So, Twin Thing, I hope that helps you understand that generally babies don't have a schedule as such. It depends if the baby is older, but we'll have to talk about that one another time. But thank you for your question, much appreciated, and please contact us if you have anything further to say. The next question is from Caitlin. Caitlin's little boy is 9 months old, and she wants him to stop having supplement feeds with formula. She wants to increase her milk supply. So again, I really do need, Caitlin, a detailed history as to what's been happening, how you've been feeding, how old your baby is, and all the things that go with the very first breastfeed, right back to the very first breastfeed in the first 72 hours. So it's difficult to give you a direct answer, but if you want to increase your milk volume, it's really important to know that your baby needs, you or your baby needs to stimulate more hormone production. And to do that, you need to either express your breasts at the end of each breastfeed to increase the volume which synchronizes with that feed, increase the hormone levels into your bloodstream that actually synchronizes with that feed. If it's not good to express halfway between 2 feeds, is because then you're taking the volume that's building up for the next feed. So if you can, to increase your volume, it's better to stimulate your pituitary gland at the time each feed has been finished, roughly once the baby's settled, and that means it's in that same one cycle where you increase hormone production, and over 24, 48, 72, 96 hours your milk volume will gradually increase depending on where you're at in your feeding cycle. Giving formula will actually reduce the baby's need to have the volume from your breast. So what I suggest, if you find that your milk is increasing, you gradually decrease the formula that you've been giving. It's wise not to stop things abruptly because it just creates chaos. And then chaos doesn't help you or your baby at all. You get stressed and you get frustrated. So gently ease off the formula while your breast milk is increasing. Watch the baby's poos for changes in colour and consistency and frequency and volume. Watch the baby's urinary output, the weight of the nappy, to see if there's any changes in that. And of course, you can check your baby's weight when you feel that's appropriate too. You'll know your baby's growing by sizes in clothes and just by looking at the baby's body and seeing how the baby's growing. So Caitlin, I hope that helps, but the only way really to increase milk volume is to stimulate your pituitary gland about 7 times in 24 hours.
She's online.
Okay, thank you. Shari is asking the question, my baby is now used to a nipple shield, and that's because she had extreme trauma due to her baby having a tongue tie. She says her baby is almost 6 months old, and it's possible to get her to, is it possible to get her to drink without the shield now? Sorry, let me just read this. Extreme trauma. Oh yes, so she's on a nipple shield, and that she gags when she tries to feed without the nipple shield. So that sort of makes sense to me, because if she's been used to a nipple shield is quite short, so it only goes to the anterior, just past the anterior tongue. So the baby's now used to using the forward part of the tongue in the mouth. So anything that goes beyond that, if she's drawing your nipple and breast tissue, she'll need to get used to. She actually hasn't had it back that far, so that's the problem with the nipple shield. They get used to it, and also with the nipple shield, they tend to chomp on it. They actually pump it rather than draw it, because they can't draw it any further than the nipple hitting the inside tip of the shield. That's as far as it can go. So they actually chomp to try and stimulate the milk volume or to stimulate hormone production and then the volume to come down. and becomes a conditioned response inside the oral cavity. So gentle persuasion, gentle teaching, maybe starting her off on the shield and then taking it away from her, gently sliding it out each feed until she gradually gets used to drawing your nipple way back further to the level of the soft palatal cleft. And the way you can experience that in your own mouth is to straighten your thumb and draw it along the tip, from the tip of your tongue right till it reaches as far as it will go to the soft palatal cleft, and you'll realise the difference in the length of the tongue the baby uses and how the whole of the oral cavity is used compared to when the nipple shield's forward in the mouth. That's the maximum the baby can get. So it's a very gentle, slow process, and try not to get distressed or stressed about it. Just guide through it very gently. Thank you very much for your question. Joanne says, I'm 7 weeks away from having my third baby via cesarean section. With both my boys, my milk took 4 to 5 days to come in, and I never had a good supply. What do you recommend to bring my milk in earlier? Well, Joanne, I would start by saying that with this time, you are asked to have your baby placed on your body immediately, and I'm not sure of your history. So I don't know what happened previously with your 2 boys. So let's focus on this little baby now. And then your baby stays on your body and in your arms and with you without being interrupted for at least the first 72 hours, if you can arrange that. That it's really important not to separate a baby and a mother at birth, at the time of birth. That a warm light wrap is placed over your baby's body and gently over the head to absorb the moisture, and your baby stays comfortably on here, and at the same time getting all your microbiomes to start preparing the baby's gut. Then when you are transferred to your own bed and you still got your baby with you, you start feeding, you start watching the baby's ability to do what it needs to do. The problem with these little babies that come via surgery is that often the mothers, well, always the mothers had opiates. So sometimes they're a bit sleepy and they may attempt to breastfeed, but they can't actually go ahead with it. So you need to be patient during that time and simulate what would happen under normal circumstances, and you may need help to do that. So if your baby hasn't fed within the first hour, you need to express both breasts, and I do have a video clip on expressing technique that you can have a look at, which I think would be helpful. And then express your breasts for roughly about 1 to 2 hours intermittently, not continuously. Have a break, express again, have a break, express the other breast. And what you're doing there is you're drawing down the colostrum like the baby would under normal circumstances, and then that milk is given to your baby to start the process of breaking down the opioids and waking the baby up. Then continue when the baby's had a sleep and you've woken up from your first sleep and you have started to recover, you express frequently both breasts until your baby is feeding. And both breasts means you express frequently over the next up to 72 hours, 3 days. You must do that if the baby's not feeding, to simulate hormone production from the pituitary gland and the filling of the breasts. If any of that time is delayed, you will find there'll be a delay at the other end for your breast filling, or you may become engorged because there's colostrum in your breast still and the milk's not able to come through and down. So these are the complications I saw in my research. So please ask for help if you need it and try and simulate what would happen. So just let me roughly reiterate that. Simulate the first feed by expressing both breasts intermittently over a period of 1 to 2 hours, a bit longer if you think it's necessary. Generally takes somewhere between 1 to 3 hours. And the baby does that leisurely. Then baby sleeps, mum has a rest, you have all the things that you need, that's happening with you post-operatively. Then when you have had a rest, a sleep, you wake up and you start expressing frequently to stimulate hormone production up to 72 hours, and then you'll feel that your breasts are filling, and you'll see that if the baby's feeding at your breast, you'll see the baby beginning to swallow more. You'll see the output changing, the poos and the wees changing. If the baby's not feeding at your breast, you'll see the volume coming in your expressing. I hope that helps, and I wish you all the best. Thank you.
She's online now.
Oh, okay. Mira, welcome. I hear you're online now. I've got my team here helping me, so I couldn't do this on my own. So I get lots of advice, and this is all very new to me, so I'm doing my very best to communicate. So welcome. Nice to know that you're there. You just had your third baby. A
newborn and a twins.
And you've got a newborn, and you've also got twins that are 2 years and 5 months old. Wow, you are a busy mum. So you want to know, you're breastfeeding them, you're breastfeeding the newborn. Sorry, do you know? Oh, your twins are feeding more than the newborn. No. Oh, goodness me. Wow, there's some negotiation needs to go on here. We need to negotiate with those two little babies, the two older ones. They don't want to play or sleep at night, and they are constantly wanting your breast. I've tried at times, tried time out and to tell them that we have milk in the morning and at night, and it's not working. Okay, I feel so tired. I'm sure you do. I'm sure you feel exhausted. I don't want to wean them, and that's brilliant. And set limits. How can I do that? Let me make some suggestions. 2.5-year-olds are very intelligent, so are newborns, all very intelligent. They understand conversation. So maybe in the way that suits you and your family best is you can sit them down and tell them a little story about the needs of the newborn baby and how their needs were met when they were a newborn baby, and make it into a story. And how important it is then, being the older baby, the older children, to share mummy's breast milk fairly. So the baby always gets the breast milk first. And maybe if they're busy twins, you can share with them alternating the breast milk after the baby's fed at the times that you think it's appropriate. So they need the story to help them understand that now they're bigger, that they could have a very special cup, and while you're feeding the baby, they can sit beside you and they can drink out of their very special cup. But to this feed, it's twin, I don't know their names, twin number 1, and next time it's twin number 2, next feed 3 hours down the track. That will give you a little break from, and you'll find that, of course, maybe food before the breastfeed might help. Before the baby's breastfeed, the newborn's breastfeed might help them not need so much, I don't know. But if they've got their own special little cup and they're sitting beside you while you're feeding, looking at their books and doing whatever they do, I don't know, whatever the choices are for you, then you may be able to negotiate with them by sharing. They will get it, but it takes sometimes a little bit of time and patience. So just be consistent with your words, consistent with your times, and gradually they'll see the picture taking place. But it is important for them and for you and for the rest of your family to know that the newborn always comes first. The newborn feeds from both breasts, and if there's any milk there or any nurturing needed, then one twin maybe can have some, and then the following feed the other twin. You can do them both together, but it's a lot of work on your body and a lot of work for you. So let me know how you go, please. That would be wonderful, Mira. Just take time and patience and look them in the eye when you're telling them the story. Animate it, telling them what's really important for their newborn baby. I hope that works for you. All right. So now, is Sarah Jane?
Yeah.
Okay. Sarah Jane says, my baby is getting on top of her projectile vomiting as her muscles are becoming stronger. She is now feeding from both sides. How do you know when one breast is empty to then move on to the other breast? Now, this is a two-part question, so I'm going to answer this part first, Sarah Jane, and then we'll see how we go with the rest of the questions. And if I can't do them all today, we'll certainly look at them later. I don't know your history, but it does appear that maybe your baby was feeding one breast per feed previously, and that's common with vomiting, projectile vomiting or positing of any sort, if the baby is feeding from one breast, one feed, and 3 hours later, roughly 3.5 hours later, feeding from the other breast. What happens is the volume over the breast that's been missed is building up to a higher proportion than what the baby's stomach size is. So when the baby drinks that volume of the breast that was missed last feed, it's too much. So that's what creates the overfull stomach, and the sphincters open to release the pressure. So you get the vomiting as the sphincter opens, and you get it running into the intestine much quicker before it's pre-digested. So you often get tummy ache as well. Colic, which is called colic. So reflux and colic are common in my experience of one-side feeding. One-side feeding can be used in a short-term response to high volume until the volume begins to regulate, but it's not something that's practiced continuously. And a lot of the women in my research were actually one-sided feeding from the first 72 hours, which meant nearly all of those babies were vomiting, were having reflux and colic. So I'm glad your baby's settling down and that you're feeding from both sides with a rest and digest period after each breast would be brilliant. And it doesn't say that, but I'm hoping that's what you're doing. And I want to reassure you that the breasts are never really empty. It's like a full-time generator going. Your pituitary gland is, every time your babies stimulate and feed from your breasts, they're producing hormones. So the hormones are coming into your bloodstream on a regular basis. So that production line is continuous all the time. The things that I use are the cues from the baby to tell you when the baby is satisfied. You don't have to empty your breasts. And if you do try to empty your breasts, what you're doing is creating more volume and refilling more than what the baby actually needs. Over time, you'll find that the baby will want to increase your supply at different phases of the breastfeeding journey, and that's normal as the baby grows. And what they do is they either ask for more feeds in that time, or they feed longer in that time, in each feed to build up more hormone release to increase your volume. So the babies are very capable of increasing your volume by themselves, and then it flattens out and regulates. So if you looked at a graph and you watch what they're doing, they grow, and then they plateau for a while, and then they grow, and then they plateau again. So watching the graph tells you about where they're at if you have a little book that does show you those things. So please don't worry about trying to empty your breasts, to drain your breasts completely. That's not how it works. It works to baby's satisfaction. And I think if you haven't already seen it, if you could just spend a few minutes watching the video clip, that will explain to you just clearly how the baby reaches satisfaction and show you the cues that the babies actually present to you, so that their baby is talking to you all the time. So stay in tune and watch your baby's cues, and then you'll understand exactly where they're at. So you don't need to empty your breasts. That's something you can just take a little step back from and feel comfortable leaving. I hope that helps, Sarah Jane. Now,
the twins.
Anya, this is another question on twins. Wow. So, Anya's saying, is it normal for breastfeeding twins, they're 5 weeks old, to breastfeed every hour? I'm currently unable to leave the house some days because they are non-stop feeding. They are putting on lots of weight and doing a good amount of wheeze and poos. So I'm just wondering if they'll ease off at any point, or if I should introduce one feed of formula just so I can get out for an hour each day. Just just to get some space, either to go for a walk or to do some yoga. My suggestion to you is that you must be really exhausted, Anya. I can understand that. 5-week-old babies and you're breastfeeding every hour. My suggestion is, again, I don't have enough history to know exactly what you're doing, but my suggestion is that you feed the babies, if you're feeding them together at the same time, that they have one breast each this feed, and the next feed, 3 or 4 hours down the track, you swap them over and they both start on the opposite breast. That each feed, they feed for a period of time till they reach satisfaction, that you put them in a position where they can stretch out and rest and digest, and then wait until they're ready and they give you the cues, and then offer them the breast again, so that each feed they will have the breast twice. That will, hopefully that will give you some space between the feeds, so they'll start to feel satisfied for a longer period of time, both gastric satisfaction and emotional satisfaction during that feed. So it's the same principle as the video clip that's up, but it's with twins. The reason I say that you change the starting side for each baby is that if one is stronger and more efficient with drawing and swallowing, then you will maintain the volume in each breast for over the feeding time. And that if you do one that's not feeding as well as the other, then you can make sure both breasts are supplying better for you that way, because the stronger baby of the two will keep the volume up for the other one. I think it's wonderful that you need to go for a walk and that you need to maybe do some yoga. I think that's really good. It's very important that you get some fresh air and some good feelings for yourself. So if you can start, say, with the next feed and offer your baby their breast twice in that feed with the rest and digest, and gradually increase all of this up to 72, 96 hours, and then just assess if you're feeling any changes and if they are settling more between feeds. It may take a week, it may take a little bit longer. I don't know how long it will take, but be patient. And if you do find that you're getting more space, then you can do the little things that you want to do for yourself. But most importantly, with twins, you need to have a rest too. You need to find time to have a rest. So let's see over the next couple of weeks if it starts to space out for you, and please drop me a line and let me know. All the best. Now, thank you. Dinah says, I'm a first-time mother and my son is 6 months old, and sorry, I'm blocking you out the paper now, and I always think I can give him enough milk. So I'm interpreting that, Dinah, to be you are concerned whether he is getting enough milk. So the ways to look at your baby, my questions to you first, because again, I don't have the history, is are you feeding him both breasts every feed? Is he having a rest and digest period in between the first and second breast and after the second breast? Is he having about 7 feeds in 24 hours? Is his wheeze, the volume good? Is he weeing reasonably frequently over the day? Some people say about 6 times a day, but just look at his nappy, feel his nappy, and assess for you and your particular baby if you think he's weeing enough. And with his poo, is the consistency, the volume and the colour and the how he's passing the poos, is that satisfactory for you too? So what volume goes in, a volume comes out. So the waste product needs to be looked at regularly to work out whether you think he's getting enough, if I've interpreted your question properly. And also his weight gaining, weight's not alone. There are a lot of things that go with weight. Is his colour good? Is he a happy baby? Is he communicating with you? Is he active? All of those things make up for you to understand if your baby's getting enough volume from your breast. And if you were concerned, then I suggest you see your midwife or whoever's been looking after you during your pregnancy, or a professional practitioner if you have any concerns. But it seems that if all of those things are positive for you, then he's probably getting enough milk, but I can't give you an absolute response to that question. I hope you'll understand. Thank you. All right. Alison. How do I get my baby to completely empty both breasts? And I think we just covered that, didn't we? Yeah, but we'll brief over it again. And how do I stop or prevent my baby from favouring one breast over the other? It's really interesting, Alison. We'll do the second part first. Is that some babies do. I don't know how old your baby is. I don't know any history, but some babies for some reason do prefer. I don't know whether it's your dexterity, because often you feel more comfortable and dexterous on one side of your body than the other. The baby's usually ambidextrous at this stage. And if that's the case, they will favour one breast. Sometimes, like our body, one breast flows easier than the other, flows quicker, may even produce more than the other one. So that could be one of the reasons why, or that could be part of the reason why there's favouring. The other one is sometimes depending on the labour and the experience or the way the baby's sleeping. Babies sleeping on their backs, tilted to one side all the time, may get stiffness in the neck, may have pain in the neck or shoulder. And if that's the case, then it's very gentle work massaging and changing position for the baby and making sure that both sides of the head and the neck are used regularly and not continuously to one side. I had a little baby who was tummy sleeping just recently, and that little baby had a stiff neck. And once we gently changed that so that the baby's using both sides of the body and turning the head and the cheek and rotating, then the breastfeeding was easier on both breasts. So it could be the reason that it could be that one breast is supplying more than the other. I don't really know the answer to that. Again, there's no need to empty your breast, because it doesn't empty, because as soon as it's getting low, it refills again. The generator is constantly working. It's probably the only generator that works as well as it does. It works fantastically. So if you're feeding both breasts and stimulating the pituitary gland to produce hormone about 7 times in 24 hours, depending on how old your baby is, as they get older, it drops back to 6 and 5. Then you'll, it's just that regular feeding from both breasts, the regular production of hormones that brings the milk down and fills your breast to a regulated volume, but they don't need to be emptied. So I hope that helps, Alison. Please contact me if you need to.
Here's our live question that's just come through.
Okay, I'm told there's a live question from Kieran. Kieran says, hello, I have a 13-week-old little girl diagnosed with reflux, and I was doing one side at a time, but now doing both sides each feed, I think the reflux is much better. I was told to hold her upright after each feed to avoid reflux, so I am concerned to give her rest and digest period, as she has to lie down for this period. Is that safe to lie her down straight after a feed? Can you kindly suggest? Thank you. Thank you, Kieran. That's a great question. Thank you very much. You don't have to lay the baby down. I suppose the most common reason I suggest laying the baby across your knee, and you can tilt them on a little pillow so they're not flat, is to watch the baby's cues, to see how they communicate with you, to know when they're ready to go to the second breast, to see all the movements they make, to see their facial expressions, to see their hands, and be really aware of how your baby's talking to you. So if you feel more comfortable holding your baby upright and extending the middle of the body out that way, that's fine. But it's really important that the baby might snuggle in and go to sleep after the first breast and then may not want to wake up for a little while longer for the second breast. And that's when we get frequent feeding, because they doze for an hour or so and then they wake up and then they want the second breast. So several suggestions. You could just have a little pillow at the side of you or on your knee that you can tilt your little baby on so the shoulders are higher than the hips. Or you could hold your baby in your arms and see how you go with that. Or even just cradle your baby so that the shoulders are higher than the hips. But it gives you both a little body rest when you're stretching out. The stretching out is to lift the diaphragm off the stomach and allow the space for the air to rise, and the baby will actually, the air will rise and the baby will actually burp spontaneously quite often. As soon as you pick the baby up to change a nappy halfway through, they burp. So they don't need to be sat up. If a baby's sat up and turned over and held under here to burp, what happens then is they're tight in that area, so there's no space. It's the same as us. If we overeat or we feel overfull, we stretch out to give our space in the middle of the body to lift the diaphragm away from the stomach. So that's the reason we do that. But you have done such a good job already. My suggestion to you is to use your instinct for your baby and work with your baby in the best way it works for you. Already you've done a mighty job. So let's see how you go. Thank you. Now we're going to, what are we doing? Another live question?
Yes.
Okay. This is from Crystal. I've been struggling with supply at 6 weeks, and that's been associated with no weight gain, so introduced express breast milk and formula top-ups. Now at 13 weeks, I'm still doing one formula top-up in the evening as I can't seem to satisfy her with breast. Is it too late? Are there still ways I could boost to eliminate this need? Again, without history, I think that's pretty good. You've given me some good information, but if it's just one feed, you could, let me think. I think I don't want to make it difficult for you. I want to make it easy so that if your baby's still having express breast milk and formula, is that right, Marie? Yeah, still having express milk and breast milk and formula, then you need to work out how it works for you to increase the hormone production from your pituitary gland at the base of your brain to create more volume. And then when you feel confident that the volume's coming up, then you gradually ease off the formula. So you drop it by 10, 20 mils a feed, hours. It doesn't have to be every feed. It can be every second feed. It could be every feed. It just depends.
It says formula about 90 mils once a day.
Oh, 90 mils once a day. I'm sorry, I didn't absorb all of that very well, did I? Yeah, 90 mils once a day. So that's not too bad considering where you've been. So what I would suggest that you do, if it's always that time in the evening, is you give the baby your breast first always. You give the baby some express breast milk if you have some in advance, and then only use the formula when you really need to. So if you can drop it back, say, tonight to 80, and then another couple of nights down to 70, gradually reduce it down over days, maybe weeks, I'm not sure, whatever works for you. Then and continue doing your breast with some express breast milk, and then gradually ease off your express breast milk, and maybe not ease off expressing, but ease off giving the volume of express breast milk in the same way, so that it's not done rapidly. If you do things rapidly, it becomes chaotic. And then what happens is you get distressed, the baby gets distressed, and the whole thing just is difficult. So just be calm, be gentle, be considerate of yourself, because you have to look after your baby. Do the things that make you feel good, and just ease back gently until such times as you've and the expressing is good, because while you're expressing, you're making the volume that's required. And if you have a look at my little video clip on expressing, that will give you the ideas of how the stimulation of the pituitary gland takes place, either by hand expressing, by using an electric pump, or a manual pump. That may be able to help too. So let's know how you go. Thank you for your message. Gosh, this one's from Claire. Hi, Claire. Hi, first-time mother to a 4-week-old baby boy. How long is the rest and digest period? My son quit often. My son
Quite often.
quite often. Oh, I see. Sorry. Quite often falls asleep after one breast. Second question. Advice, please, for us a strong letdown, possibly causing tummy to fill too quickly, and then he has terrible wind pains afterwards, and any help appreciated. Okay, so let's go back. He's 4 weeks old. There's no time to the rest and digest feed. The whole feed will take about 1 hour, roughly, for a 4-week-old baby. So by the time the baby's been satisfied from the first breast, both gastrically, this is the size of the stomach, which is the size of the baby's closed fist, about that size is a good guide. My fist is about the size of my stomach, so my closed fist. So if you use that as a guide, the baby feeds to satisfaction, gets into that sleepy, dreamy state, and then nurtures for a while. When he's finished nurturing, that's the time to rest and digest and to let him stretch out. And so if you hold him against your body, he may doze and go off to sleep, and then you end up with this short-term one-sided feeding happening. So he has a short sleep, then he wakes and wants a second breast later. So by stretching out, he's able to work the digestive process much better. I think I just explained that before. Work the digestive process much better so that there's room for the enzymes to break down the volume of milk in the stomach. He feels more comfortable because he's not crunched up. He has room for the air to rise, and it takes roughly time for the enzymes to break the milk down and to start transferring it into the intestine pre-digested. Then he'll get busy with the cues again, his arms and legs, he's turning. Sometimes they lift their head very gently, very slightly. The tongue starts protruding. And then the last part is the voice starts calling. So when the voice starts, it'll get louder, the longer we let it go. So you can talk to your baby in what's right for you, what feels right for you. But, on average, I don't time anything because I use the cues, right? So don't go by time. So about an average time might be 10, 15, 20 minutes before the baby's giving you the cues to go to the second breast. So it's really important to do the second breast so that maintains your volume. It makes your breasts comfortable, both of them, and it also makes the baby's digestive system much more comfortable. Have I
Just saying he often falls asleep after the first breast.
Yeah, I'm not sure how you're holding him or what's happening after the first breast, but if you're starting with the breast that you finished on last feed, that will help. So that, like, for example, this is how I explain it. When they're hungry and they wake up, they take most milk from the first breast. Then they rest and digest, and then they take some more when they're ready from the second breast. And that's all about the individual baby and its capacity and its requirements of that particular feed in the 24-hour cycle, because it may change the next feed. It may be different each day. It's not always the same. But it's about that. That's how it works. Then the next feed, 3 hours down the track, you start on the breast that you finished on last time, which is this one. Finished on this one, and then you rest and digest and you go to that one. So that tends to give you a more balanced production of milk from your breast. So if you can keep starting on the same breast each time, the high volume will come down really quicker, and then it just doesn't create the balance. So starting with the last breast used does help create the balance, and I'm not sure if you're doing that. I think, let's see how it goes, and let's see if you can give me a text or something, or a message, not a text, message, and let me know how you're going. I think, have I answered that, Marie?
She also has a strong letdown.
Oh, you have a strong letdown. Well, that tells you that if your letdown's coming rapidly and fast and it's strong, that tells you that there's good volume there. Already the hormones are stimulated and the milk's coming through the ductal networks, through the breasts and out the nipple ducts, and over the back of the throat through the nipple ducts that are when the baby's drawn the nipple way back to the soft palatal cleft. And that will make the baby really draw and swallow, draw, swallow. draw, swallow, and you'll see the baby trying to keep up with the flow that's coming out of the nipples and ejecting out of the nipple over the back of the throat. And each time that spray hits the back of the throat, the baby swallows. So they have a very coordinated drawing, swallowing and breathing cycle that goes on. They can actually do that very well. So the strong letdown's probably okay. It's probably maybe that one breast is fuller than the other, possibly.
Tummy pains, like wound.
And he's got tummy pains, which tells me that then he's probably getting a lot of volume fast, and that possibly he's starting on the fullest breast first, or could it be that he's one-side feeding? So one feed he has one breast, and 3 hours later he has the other breast. And if that's happening, that will definitely give you high volume to start off with, full flow to start off with, and then tummy aches soon after that, with lots of milk going through too rapidly to pre-digest because the volume's too high for the stomach capacity. And so the stomach has to relieve that capacity and send it into the intestine before it's been pre-digested, and that's what causes the tummy ache. So, and you see, the second part of the digestion is in the bowel. So we have to pre-digest in the stomach first before it goes into the bowel, and break it down in the stomach, and then the bowel takes over and does more digesting until it becomes, right through the intestinal system, it becomes a waste product. I hope that answers. It's giving you a few things to think about. I hope that helps you understand that. Michelle, this is from Michelle. Can you comment on how normal or abnormal green poo is for a 15-week-old exclusively breastfed baby? Doctor suggested an intolerance to cow's milk protein coming through my milk. Also mucus in the poos at times, still gaining weight, maybe slowly, and very happy settled baby, but does feed quite frequently, around 2 to 3 hourly. So for a 15-week-old, maybe 3 to 4 hourly, but who knows? It's very different. So around, there's lots of things happening in the progress of change. Your baby, your doctor's right, your baby could have an intolerance to cow's milk. Is there a family history of intolerance to cow's milk or to cow's milk products? Have you ever had an intolerance to cow's milk products? The things that I would ask you to consider is, are you taking something as a common denominator every single day? Are you taking supplement drinks? Are you taking supplements or tablets by mouth or capsules by mouth? Is there something in your eating or drinking that you're having as a constant denominator every day? They would be the things that I would be thinking about. And if they are, if you can stop for at least 4 to 5 days to see if there's any difference in your baby's behaviour once you've done that. The other thing around 16 weeks is you've got teething going on as well. So often tummy upsets occur when there's teething, and also pain because the teeth are moving in the gums and rubbing the nerve endings. So the trigeminal nerve here is affected, and you'll get little babies, really wanting to chew and bite, and that's all good. They need to do that, or you can massage gums for them. The other thing that I don't know you need to consider is, have you started contraception? And if you have, sometimes that can make a difference to what happens with your milk, and sometimes your milk volume as well. But it seems to me that you have got some mucus in the poos. The poos is green. It seems to me like it's going through either quite fast, or there is a response to something that's a common denominator every day. So if you were having a glass of milk every day, it could well be that, or more than a glass of milk every day. The most common things that I learned about by pure chance was a mother who was taking fish oil, had been taking it in pregnancy, had been swallowing it during her baby's breastfeeding, and her baby was gagging, quite sick and very distressed. So fortunately, she was able to give me some of her express breast milk, and between us we tasted a very small amount, we smelt it, and it was pure fish oil coming through her breast milk. Another lady who was taking a multivitamin told me that her breast milk was really bitter. I didn't try her breast milk with her. We just cut the tablet that she took every single day in half, and it was extremely bitter, very bitter to me and very bitter to her. And she says, oh my God, that's it. So it's just for you to think about if there is a common denominator of any sort. Some of the supplement drinks that are high in vitamins, sometimes they create pain for the baby in the gut, and they may create mucus production as well.
She said she was taking fenugreek and
lecithin tablets. You're taking fenugreek and lecithin. So that's every day. So use your instinct to see. The fenugreek is to maintain your supply. Smell and taste what you're taking yourself by breaking the capsule or chewing the tablet, and see if there's a connection for you. And then you could either, for those, you could either stop both of them and see what happens in 4 weeks, about roughly 4 or 5 days, see if there's a change, and then over weeks. Or you could do one at a time and test it and see if there is something coming through, either of those, that could be irritating your baby's bowel. Let's see if that could be one of the reasons. All the best. I would like to hear some feedback. Thank you.
This one just came in.
This is Cherie. Cherie has an 11-week-old baby girl, and she's feeding every 1 to 2 hours. I do feed from both sides, but don't feel she stays full. She stays full for 3 hours at a time most times. Any advice for me? So she doesn't feel that she stays full for 3 hours. So she wouldn't stay full for 3 hours, but she may have 7 feeds in 24 hours. So, for example, if she's having 8, 9, 10 feeds in 24 hours, maybe she's not getting enough volume. And I'm just trying to think, how old is she?
11 weeks.
11 weeks. So she's coming up 12 weeks, which is sometimes a changing period for little babies that are breastfeeding. Again, the beginning of teething's going on. They're not actually teething at this stage, but the processes are going on. But it's more likely to be leaning towards. Let me think. I need to think clearly, because I can't it's really hard giving direct responses when I don't have enough history. So she's almost 12 weeks. She's feeding every 1 to 2. So she's feeding frequently. So if she's feeding frequently, she's probably asking you for more because she's not feeling satisfied. So does she have tummy ache? Is she unsettled? If that's the case, what's her wheeze and poos like? What's the consistency, the volume, the characteristics of her poos? What's her wheeze like? What's the volume like? Is she okay with all of her output? Is she growing? Is she putting on weight? And again, weight's not an issue on its own. It's about gaining weight. Gaining weight according to the individual baby, but she'll have a bit of a plan going on. The other thing is that when you're feeding her, are you aware of face-to-breast symmetry, the symmetrical contact with the baby face-to-breast, to get best potential oral cavity work going on, to make the volume, to increase the pituitary gland function, and to make the volume in your breasts. So that's nostrils, point of chin, and both cheeks resting on the breast and snug at the breast. So what happens is the chin massaging deep in the breast, massaging glandular tissue, the nostrils resting on the breast as the baby draws, the lip sits just under here, and then what happens is they're breathing through each side of the nostrils down here, and the lips gently roll. They don't actually flare right out for most babies. Some they will, others they don't, and they draw the nipple right back to the soft palatal cleft, which means the following breast tissue moulds to fit the upper palate, the hard bony curve up the top, and makes a unique teat in the mouth. If the baby's actually away from the breast and feeding on the nipple, then the volume won't be as good as if the baby's actually drawing all the way back and is snug at the breast. So maybe focus on that. If you haven't already done that, you may well have done it, I don't know. And just see if you can space the feeds a little bit. So if in 2 hours, 1 to 2 hours, allow another 15 minutes if you can to before you start the feed, and then the next feed try to go half an hour roughly. Look, I'm not giving you set times, I'm just giving you the idea. So you're extending the feed in between the feeds, starting time. So starting time, start a feed to start a feed, next feed is roughly 3 to 3.5 hours for a baby that age, roughly, not set, because if they have a longer sleep, they'll maybe bring some feeds a bit closer together to fit the 7 in 24 hours. Does that make sense? So let's see how you go. But focus on face-to-breast symmetry, extending the space between the breasts a little bit, the feeds a little bit, so that until you get up to about 3 hours, maybe 3.5 hours if you can. And please give me some feedback if you'd like to. Thank you.
This is a long one. She's put in her question a few times. Hira.
Okay, this is quite long, Hira. Hira has a hi Hira, thank you for your question. Has a 4-month-old baby girl born by cesarean section. She's been combined feeding since birth because of low milk volume. She's been taking natural remedies to increase her, so Hira has been taking natural remedies to increase her volume, and tried high lacta capsules, which I haven't heard of high lacta, 3 times a day. But since I belong to a Muslim community and it's Ramadan, in which we fast for 16 hours, I've noticed that my supply has been markedly reduced. I am a working mother. I use a pump. I used to pump at work, but now that the supply isn't well enough to pump, so now my low.
Not sure what that means.
Her baby is on top feed completely. I don't understand that.
Probably formula.
Yeah, I want to give her breast. She wants to give her breastfeed. Okay, she wants to continue breastfeeding her, but she's got low volume in cutting it short. The problem is she's fasting herself at 16 at the moment for Ramadan. Okay, so if you are fasting and that's what you have to do, I can imagine that you can expect to have your volume reduce. So if you could, over that time, particularly over that fasting time, if you could express your breasts after each feed around 7 times in 24 hours to keep the hormone production coming from your pituitary gland to fill your breasts, to start increasing the volume in your breasts at least, then I think that would be a good start for you. Fasting won't help you produce milk. I understand that's a need of yours to do that, but it's just being truthful about, that's how our pituitary glands work. So my suggestion is to try to get more hormone production about 7 times in 24 hours into your bloodstream to start building your milk volume. Just let's do that at first. Just go one step at a time, because you're a working mum as well. If when you're away from your baby and it's gone, more than 3 hours, you should really try to be expressing both breasts. That means while you're at work, if that's possible, and taking that milk home for your baby and giving it back to your baby after you've breastfed if you need to. Try to get 7 feeds, so you're simulating the baby, even if you're not there, having had a feed by expressing your breasts. And that needs to happen around 7 times in 24 hours. If you can get that rhythmical cycle happening, it's highly likely that you'll start to build up your milk volume. I wish you luck and would love to hear some feedback. Thank you.
This person is from Mauritius.
Okay, we have Kershid here from Mauritius. Hi Kershid, how are you? What is the best way to feed my 4-month-old baby? My 4-month-old baby express breast milk. I'll be getting back to work soon. Okay, with all the information we've just suggested, I think you continue that. If you're going back to work and you want your baby to have express breast milk, then you need to express around 7 times in 24 hours. If it's a high volume, I suggest you express the left breast into one container and the right breast into another container, because the babies do not drink from both breasts at the same time. And what happens when we do mix it all together in the bottle, it can upset their digestive system. And then what happens then is you get the baby with a bit of colic going on. So it's not... we want to simulate as much as possible what would happen under normal circumstances. So the best way, I would say, to give a 4-month-old is to cup feed. So there is a little video clip on cup feeding. I think it was a 4-month-old, wasn't it? Yeah, a little 4-month-old in Australia. And so he's feeding from a cup. That might give you an idea as a starter. I usually start with a small medicine cup to start with, and then we can graduate to a glass, and before you know it, they'll be drinking from any cup. Babies are quite capable of drinking from a cup. It's not that you're pouring the milk in. You're actually you're sitting them comfortably and you're tilting the milk to the lip, and they'll actually lap it. They lap it in a way that simulates drinking, and then they take it over the back of through their mouth and over the back of the tongue into the throat. And you'll find that if you watch this little video clip, you'll see this little baby. First of all, he says, "What are you doing?" He didn't like it too much. And then all of a sudden he got the rhythm right, and he just held his mum's hand and saying, "More, give me more." He wanted it. So watch your baby's behaviour too. But I would say from a cup, if you feel you need to use a teat, it's highly likely the baby will get used to teat feeding and bottle feeding, because it's totally different to breastfeeding. It's fed by gravity, it's fed irregularly, and it doesn't let down like the breast does. So what happens is the babies fill quickly and they get used to the silicone in their mouth, and they adapt their oral cavity to using the silicone, either biting, chomping, or trying to draw to the best of their ability, depending on the type of teat that you use. And that they get full-on gravity feed most times, and they're over and fed in very quick time. So then they become conditioned to that, and they expect to be fed like that. And when they come to your breast and they want to breastfeed, they don't really want to work to get the letdown anymore. So I've seen that happen quite a lot in my practice. So I would say cup feeding at 4 months is fine. And if you feel uncomfortable about that, just get the longest possible teat that you can get on the market. So you would measure it roughly from the tip of your finger to the second joint, way down here, and that's right to where the plastic cap is. So you would want your baby's lips right to the plastic cap. So you let the baby draw the teat rather than you put it in. You actually let the baby draw it back. You might help a little bit, but you're not pushing it in. The baby has to vacuum it along the upper surface of the tongue. And you sit the baby up so that there's no milk in the teat to start with, and they have to stimulate, stop, stimulate, stop before they get the letdown to come. So then when you think they've stimulated 3 or 4 several times, tilt the baby back with the teat, the same angle. Don't alter it. You don't alter the teat or the bottle. You tilt the baby back so that, this way, so that the milk flows through the teat, and then you give the baby a letdown. And you let the baby draw, swallow, until you think that's a reasonable letdown. Then you sit back up again and you make them work for the next one. So when they come back to your breast, they're used to having to work to get the milk to come. So the transition between a bottle, teat, breastfeeding is much easier. Cup, they don't worry too much. They'll breastfeed and cup feed. So I wish you well. I hope it works, and let's know how you go. Thank you for your question.
Maybe just a couple more?
Yep, just a couple more. How have we been going?
Over an hour.
Over an hour, wow. Okay, Leah says, hi. My 12-week-old baby has been sick with bronchilitis and been off food, so my supply has suffered. Will she just increase it as she gets better, or shall I do something to increase it? That's a good question, Leah. It depends on how you feel, Leah. If you think she's feeding to increase your volume, then that's good. But if she's not, I would, at the end of each, I'd offer you breasts, and at the end of each feed, I would just express for a period of time, just to stimulate more pituitary hormone release into your bloodstream, so that if you did that, if you could do that for 7 feeds over 24 hours, you would find that that extra release of hormone will start to refill your breasts more and more. And what happens, you'll see the baby drinking, but you won't see as much in the volume of expressing. But what the expressing is to stimulate the hormone, not necessarily to get volume. It's about increasing the volume in the breast so that over 24, 48, 72, 96 hours, however long it takes to gradually build up your supply, that extra component of hormone release into your bloodstream will help. I hope that makes sense. Thank you for your question, Lena. And this is the last one?
Yeah, I think that's
all
right. There are more questions there.
I'm told there's more questions, and I'm really sorry if I haven't met all of your questions, but I will try. My team will help me look through the questions and see what we can pick out that's, coming through as a common denominator, in other words, or a common question. Danielle, my son is 6 weeks old. He falls asleep on the first breast and feeds frequently. So yes, that's what happens when they fall asleep after the first breast. They'll feed frequently because they have a short nap before they wake up and want the second breast. So what I would do, rather than wake him up for the second breast, I would stretch him out on your knee. Once he's finished the first breast and he's reached that lovely satisfaction where you see him drifting off, and then he just nurtures at your breast for a little while, like a little butterfly, and then he slips off. Then stretch him out on your knee or on a pillow beside you. Hold him up if you want to, but stretch him so that middle body is stretched out so that he has time to digest that milk, and then he'll wake up and he'll have, when he's ready, he'll show you the cues, which are on the video clip, which you, if you'd like to have a look at it, and watch the cues for the baby talking to you to say, I'm ready for the second breast. And then when he has the second breast, a feed will take about an hour, roughly an hour at this stage, 6 weeks old. And then that will space between the feeds for you and fit in around about 7 feeds in 24 hours. I'm averaging about 20 feeds in 7 feeds in 24 hours on the average, but it might be 6, it might be 8, I don't know. And yes, I would offer him the second side every feed so that you can get some space and the frequent feeding settles down. It may take a week, it may take a little bit more. And I don't actually, if you're using both breasts each feed, I don't worry about foremilk and hindmilk, because your breasts refill comfortably to the baby's needs all the time. And the volume of milk that's in the breast, unless your breasts are really overfull, extremely overfull, will make a difference between foremilk and hindmilk, the lactose and the fat in the milk. But most babies draw down the lactose and the fat that's right for them, and there's always fat in the milk somewhere along the line. So the research shows that there's always fat in the milk. It's only when you've got a really high volume that's oversupply that they may take the top off first, and that's what happens. So and because he's frequently feeding is why he gets windy, because the frequent feeding is happening too fast, too quick into his intestine, and the pre-digestion phase is not working as well. So please have a look at the video clip that shows you Laura feeding her baby from both breasts with the rest and digest period, and how the baby's cues are for talking, and head towards that, and let's see what happens in another week or two. Thanks for your question. Thanks for joining us. And thank you to everybody who joined us today. What a great time for my very first time on Facebook Live. Please take time to have a look at the video clips if there's anything there that you think will suit you. They're on my Facebook page and they're on YouTube as well. And you might have friends that might like to ask questions or come along to the next session. I'm told by my team that we'll be doing regular sessions. I take orders, you know. And I will try to cover as many topics as I can to make it easy so you can all share the information. My aim is to share so that you can help each other, that women can help each other, that women are strong, women have the knowledge, and our midwife colleagues and those who look after you will work together with you based on the same information. And I'm hoping that we can lift in Australia particularly, and I know other countries have low breastfeeding rates. We have about 15% at 6 months in this country, and we're hoping that between us all of you and the women that are contacting me from around the world, that we can gradually increase the breastfeeding rates and reduce the cow's milk feeding rates. Let's see how that goes. So I hope what we've gone through has helped many of you. I hope that the sequence of events makes sense to you. If I've missed your question, I'll try and get to it again later. Please feel free to share my information, and if you are desperate to have a question answered, you can contact my team and they can arrange a Skype session with me. It depends on where you are in the world, what time it is. It doesn't matter to me. I can be up at any time, but it needs to be arranged so we can do a proper session. And I like to do a full breastfeed with you when the baby is waiting for a feed, and also to take a detailed history from you, because then I can make our session together unique to you and your situation. In these sessions, it's broad information. But thank you once again for joining me.